All right, accidents and illnesses happen, but how do you know when to take yourself or a loved one to the emergency room?
Yeah, I think a lot of us debate this, right? We're chatting with a doctor about 10 reasons you should go to the emergency room without a doubt, and also when to skip it. It's up next. It's 8:11. We'll be right back. Talking about something really important, because it is one of the most important decisions you'll ever have to make. We're talking about when to take a loved one or even yourself to the ER. So we have Dr. Sharon Thompson of Central Phoenix Obstetrics and Gynecology talking a little bit about when we need to go and when you really should not go at all. This is, I think, a lot of people debate this.
Absolutely, and we never want you to feel like you need to go to the ER and stay home. We'd rather see you, but there's some definite times when you should absolutely go.
Okay, let's talk about those things first.
Chest pain that you can't point to. Heart disease is the #1 killer of all Americans. So if you have chest pain that just feels like something's sitting on your chest, take an aspirin and go to the ER.
Okay, take an aspirin first.
Absolutely.
Okay.
Because for heart attacks, aspirin can be very helpful. It can be life-saving, so you definitely want to do that. If you or a loved one you notice has slurring speech, any change in mental status, face is drooping, that could be a sign of a stroke, also take an aspirin. Go to the ER.
Okay.
So those are two major killers of Americans, and you definitely want to pay attention to those. Bleeding. If you put pressure, like your mom said, put pressure, but if that doesn't work after 15 minutes, go on in.
I was going to say, is there a time limit? Because we hear that usually it does stop, but 15 minutes
usually
is the
it will
time
stop,
frame.
but if it doesn't, don't be a maverick. Don't be a cowboy. Go to the ER. You might need stitches.
Men, that might be for you, right? Because we hear the guys like, it's fine, it'll go away.
Yeah.
All right, next thing we want to talk about, aside from that, some of the other issues.
Some of the other issues can be breathing difficulties, especially if you have a history of asthma and you've been taking your medicine and it's not working. Go in. It won't work in 30 minutes if it didn't work in 5. Go on into the ER. Or if you've eaten something new, because allergies are a serious problem, and sometimes allergies can cause you to have difficulty breathing. So you've eaten something new at someone's house, a new restaurant. Go in if you have trouble breathing. Very important.
That makes sense too. And a lot of people question that because especially when you have little kids who may sound like they're just, you know, breathing hard, but when is it the right time to go? Especially with kids, you got to be careful.
I like to say breathing is not optional.
Okay. Yeah, we have to breathe. We have to do that thing. All right, next thing that we want to talk about is this. When you talk about, what about like a headache that won't stop?
Yes, so there are 2 reasons why going to the ER for headache may be necessary. One, if you have a headache that lasts more than 3 days, you probably at-home medicines are not going to work. So you want to go in because you might need medicine by IV. Can't do that at home, you got to go in. Or if you have what you consider the worst headache of your life, sometimes that can be the only sign that you have bleeding inside your brain. So you definitely want to go in for that. And people will almost always say, boy, I feel like I got hit in the head with a sledgehammer. This is the worst headache I've ever had. So go in for that. That could be very serious.
All right.
Another time where head pain can be an issue is if you hit your head. So if you hit your head and you lose consciousness,
well, that feels like you should go, right?
Time, or you see stars, go in. Concussion, we hear about that with football players, with sports players. It can be a serious brain injury. You want to go in for that.
All right, very good. And those are some important things that I think will come up or have come up probably that you just didn't know. So now you know when to go. When not to go. A cold that someone feels like it just won't go away.
It is cold and flu season, so colds are going to come. And almost every year, we all swear we won't get one, but we do. And you have the fever and the chills and you feel terrible. Colds can last for 7 to 10 days. The vast majority of them are viruses, and they will go away, even though you feel miserable and it feels like it won't. So you don't have to go in for those. If it's lasting more than 10 days, still don't have to go to the ER, call your doctor.
Call your doctor. There's a big difference.
That's the first place to go.
What about, you know, here in Arizona, a lot of people may get that sunburn. It may feel excruciating, painful right that moment, but that's maybe not a time to go to the ER.
Not a time to go to the ER. Time to call your doctor maybe. If you're blistering, if you're miserable for more than a couple of days, definitely give your doctor a call, but not an ER visit. We want to reserve ERs for people whose lives need to be saved right now. And that way you don't have to worry about these long waits. We all have that experience. You go in, you wait 8 hours, and that's because the doctors and the nurses are busy treating people who are dying, and we want to save those lives.
Attend to those folks, and it can be pricey when it doesn't need to be.
Yes, it can.
Dr. Thompson, we sure appreciate your advice as always. Thank you so much.
Thank you for having me. Appreciate the opportunity to talk to all of you about staying safe, staying healthy.
Yes, indeed.